long-term care, considerations, problems, and solutions. When is it a good time for you to have that difficult conversation with your loved ones about how they want to live out the rest of their years? My guests today will include Raymond Weiss, Vice President and Chief Long-Term Care Officer, Dr. Timothy Bieland, Vice President and Chief Medical Officer, and Terry Lynn Strode, Director of Nursing at Fairview Nursing and Rehabilitation Center. We're also going to be discussing post-acute care right here from the Bluff Medical Center. This is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're here at Bluff Medical Center and we're discussing options within the continuum of care. And I've got a great panel of folks with me here today. Before we start talking about the different types of care that's on the continuum, Raymond, I'm wondering if you can give us an idea of the overall scope of the problem and why we are discussing it today.
Sure. I think, well, first of all, thank you for having us on this morning.
Yeah, thanks for being here. Your first time on the program today,
It is.
So welcome.
Thank you very much. Thank you very much, Justin. I think from a larger trend standpoint, what you're going to see is a rapid increase for need in long-term care services. Partly simply because of the increase in population of those who are over 65. Experts call it the silver tsunami. Roughly today there's about 40 million Americans 65 and older. By the year 2045, that will actually swell to close to 88 million Americans. So definitely significant move in trends there.
Yeah, large numbers growing. And we have a pretty good idea of what this problem is then, obviously. There's sort of a care shortage. But let's talk a little bit about what the continuum of care actually is. What all does it encompass?
Yeah, when we think of the continuum of care, I think you're thinking about really looking at levels of dependency for people when they're aging. And so you have to have an entry point, and that's typically an independent living center that Bluff has here, but is a typical entry point for most people that don't want to mow the lawn anymore, or just simply have a little bit more need to care for themselves within the home. And so from there, you really move more into a assisted living area, referred to as both CBRFs and residential apartment complexes. And those are really just different levels of care at the assisted living care.
Okay, and remind us what CBRF stands for?
Sure, it's community-based residential facility.
Okay. And
it's basically just a higher level of care in the assisted living area.
Okay, so it's kind of, it could be in the same facility potentially as the RCAC.
It certainly could be.
But it's just a higher level of care.
Exactly.
Okay. Well, let's talk about, because I know skilled nursing is on the continuum of care. So Terry Lynn, can you talk to us a little bit about what skilled nursing is?
Skilled nursing is where a patient needs a skilled service every day. So it could be a registered nurse, it could be physical therapy, occupational therapy, and then having assistance from CNAs, certified nursing assistants, or restorative aides to promote getting from that low endurance where they've been sick and getting them back to the highest functional level. So either they can maintain in the nursing home or we send them home.
Okay, so they could stay in the nursing home or send them home, but those are both considered skilled nursing.
Yes.
So we understand now the differences in these types of care. Dr. Bieland, if any of our viewers have someone in their family who may need these types of services, what are some things to consider when making the decision?
Well, I think first and foremost, whenever you're looking at care for a parent or a loved one or family, is really starting that discussion. I think because there's a lot of fear and a lot of unknowns and anxiety related to this process, I think that a lot of families sometimes put off having that discussion, that getting together and to really just saying, what if? And what could we do as part of that? And really what the what ifs really are entailing is saying, if you have a choice at these particular points, what would you like us as a family to do to help you? So that might be simply just saying, hey, If possible, I'd like to stay in a home-like situation, which Raymond talked about in the apartment, where I might just need somebody to come help me, get dressed or keep the area clean or get a meal.
Right.
Versus I might need some more assistance with managing my medicine and those kind of things. Or even going to the point of saying, it might require some nursing care, but the other portion of that silver tsunami is also the demented patient. And although we're very fearful of dementia, we also know that those patients really do need care and decision making, and they're not going to be able to do it.
Yep, absolutely. We got to take a short break here, but when we come back, we're going to talk about some examples of what would bring somebody to a point where they might need to make that decision. So we'll be right back here at Mile Bluff Medical Center with more Wisconsin Doctors. Welcome back to Wisconsin Doctors. We are here at Mile Bluff Medical Center, and we've been discussing options for continuum of care and some considerations. At least in this segment, we're going to be talking about some considerations and some examples of how someone might find themselves in a situation where they need to make a decision about whether or not to put a loved one in some sort of continuum of care situation. So, Terry Lynn, I'm wondering if you could give us some examples of how someone might find themselves in a situation where they or their loved ones may need to make a decision as to whether they need this type of care.
Okay. Unfortunately, as we get older, our balance changes.
Right.
And so the biggest one that we see are patients who have fallen and they've broken their hip. So they end up in the hospital, they end up with some surgery, and then they can't go home because they live by themselves. Most of them are widows or widowers, and so they need to come somewhere and get some rehab. So that's when they'll end up in my facility or Crestview. The physical therapists and the nurses are there to help them get back to the level they were at.
Sure.
And heal that wound and get them stronger.
Yeah, try to get them back to some level of independence if that's possible.
Yes.
Yeah. So it sounds like there's an event that usually takes place that leads up to somebody kind of deciding, hey, I can't live on my own, or their loved ones say you can't live on your own anymore. So, Raymond, I'm wondering if you could help us out here. We've been discussing the planning for these types of unfortunate events, but perhaps too often some of these plans do not get made. And so we talked a little bit about before the show how it often ends up by escalating into a crisis situation for the family. So what have you seen happen after the patient experiences an event like what Terry Lynn just described and now has to be admitted to one of these facilities?
I think the biggest factor in that is the family dynamics that play into. We all have families and certain dynamics in those families. But during a crisis in families is when those dynamics really come out. And so what ends up happening is the family actually becomes the biggest part of the care. That we're not just caring for that patient who has suffered the event, but really the family.
Right.
And part of it, the reason why it becomes a crisis is because sometimes we, as Dr. Bielen mentioned before, we have fear of the unknown, so we don't want to have those difficult conversations.
Right. Yep, difficult conversations. And Dr. Bielen, I think you had something that you wanted to add to that a little.
Well, I think, as we look at that family dynamic, one of the things that we are concerned with is that as physicians or as caregivers, we often have to start making difficult decisions in that process. And so the more the family has prepared before that event, the better it generally goes for us to be able to deliver that care in a way that doesn't cause so much anxiety or conflict.
Right, absolutely. And it's, whether you like it or not, if something like that happens, the whole family's in on it together.
Absolutely.
And they really kind of have to be. So, Raymond, what are some of the decisions that families really should be making specifically prior to an event like that happening?
Sure. I think one of the proactive steps is to reach out and talk to some long-term care providers from a financial standpoint. There's some experts that really allow individuals then to do more planning. What is the financial burden going to be to the family? And that's sometimes a part of that difficult conversation that people don't want to have. but it's certainly a proactive measure that is proven to be very helpful.
Absolutely. I think there's a kind of a tendency too for people to maybe think, well, mom and dad will just come and live with me, once they're too infirm or whatever to live on their own. But unfortunately, so many people are working beyond 65 now, even that their parents, who may be 25 to 30 years older than they are, they can't be at home to watch their parents and make sure that their loved ones in general, and make sure that they're okay. So having those decisions and thinking of that financial piece may not be the first thing on their mind, because they think, well, they'll just live at home.
That's right.
Yeah.
That's even beyond that. It's two people need to be working.
Right.
Everybody needs to be working. People taking care of grandkids. All of those other dynamics play into it too.
Yep, absolutely. We're going to take a short break here. When we come back, we're going to talk a little bit about Mile Bluff's role in all of this situation. We'll be right back here with more Wisconsin Doctors. Welcome back to Wisconsin Doctors. We've been at Mile Bluff Medical Center discussing continuum of care options, and we've talked a little bit about the scope of the problem and the different types of care and the things that families need to consider or agree on before an unfortunate event happens. But I'm curious to know, Raymond, what role does Mile Bluff play in all of this?
I think first and foremost, Mile Bluff needs to be a resource to our community, especially for our elders. And so what does that mean? It means really partnering with our community organizations, organizations like the ADRC or the Aging Disability Resource Center, so that our community really feels that we are a resource for many of the things that we've already talked about today.
Yeah, absolutely. And I know there's a lot of needs for the home caregiver, the person who has been taking care of an individual, at their home for however many years or months or whatever. Dr. Bjelland, can you discuss some care that you guys give to the caregiver as well?
Yeah, I think you hit the nail on the head in the idea that, the person who's caring it's 24/7. It's a very difficult role to play. And a lot of times they don't have a lot of what we call respite or break from things. And they really don't, sometimes they just don't have the other family resources. It's not that the families don't want to give it, but everyone's busy and all of those things. So we're looking at ways of developing respite care for people, be able to say, bring your relative here for a period of time for us to be able to take care of that person for a day or two, or if you have a family crisis or something like that, to be able to give them an opportunity to go deal with that so that they can come back and resume their role of taking care of that patient.
Absolutely, sort of recharge their batteries a little
Absolutely.
bit. I want to discuss Terrace Heights, which is not connected physically to this hospital, but it is definitely on the Mauston campus here for Mile Bluff Medical Center. What exactly, Raymond, is offered there in terms of care at Terrace Heights?
Sure, and independent living really is that entry point, typically, where someone is just looking for a little less responsibility in their living environment. But the focus really has to be on wellness and preventing people from eventually having those events, falls and otherwise. So wellness and a sense of independence for people to age in place as long as they can in that particular environment.
Right. And we talked quite a bit about how it's often an unfortunate event that brings people into the continuum of care. But it sounds to me like Terrace Heights might be sort of the preempt to that, the precursor that to prevent something like that from happening, maybe you'd want to make that decision prior to an event.
Absolutely. And we're being very intentional about providing that wellness approach so that independence can be maintained.
Yep, absolutely. Now, Dr. Bjelland, I mean, that sounds like the entry-level version of the long-term care. But Dr. Bjelland, you also have another facility here, Crestview, actually in New Lisbon, which sounds like it might be on the other side of the spectrum. Can you tell us a little bit about that?
Yeah, I think that's true. I think that Crestview is kind of the end-of-life residential care. And what I mean by that, we had talked earlier about patients that are demented and not able to function on their own. And so Crestview really has an opportunity to transition that early dementia patient in a CBRF type of setting, the community-based residential living there, moving all the way into a kind of a residential home-like environment to care for them. And then finally, when their dementia is really bad and they're wandering and other things, to be able to give a skilled unit, a locked unit, where you can keep people safe, even allow them access to the outside, but still not allow them to wander or harm themselves, and to have the care that they need. And so that's a really wonderful kind of end-of-life continuum, particularly for those demented patients.
Absolutely. And when we come back, we're going to talk a little bit about Fairview Nursing and Rehabilitation Center, which is attached right to this building here in Mauston. Don't go away. There is more Wisconsin Doctors coming up after the break. We've been discussing Continuum of Care here at Mile Bluff Medical Center, and before the break, we talked about a couple of different things that Mile Bluff is doing for the problem, and also some of the facilities that you guys have here. And we didn't get to talking about the Fairview Nursing and Rehabilitation Center. So I'm wondering, Terry Lynn, that's a facility that's connected right here to the hospital. Can you tell us a little bit about what goes on there?
Yes, we get patients from our hospital and outside hospitals, and once that patient arrives, because they need our services, they'll meet our social worker, a nurse, the physical therapist, the occupational therapist, the whole team.
Sure.
And the evaluations are done. And then after a couple days, my team will meet with the patient and start talking about discharge. Within that really short period of time, we want to talk about discharge.
Yeah.
What is your potential, and how do we get you there?
Right.
There are times where it might take longer, but we will get you there.
Right.
But then there's also those times where you're going to have to stay
Sure.
a little longer, and maybe longer than that.
Sure.
But our main goal at Fairview is to get people home.
Right, to get people home, and if they can't get home, then at least get them to a certain point of it, whatever independence they can maintain.
Right. Do they need to go to Terrace Heights? Do they need to go to a different community-based residential facility, or can we get them at home with services?
Sure.
At Fairview, the nationwide trend is a lot of this rehab. And so right now we've got a team, and we're looking at this, and we're looking at changing up our whole facility.
Okay.
How do we make it so that it is more accommodating to these 65-year-old patients?
Right.
Private rooms. Right now we're semi-private, so we want private rooms. The smart TVs.
Right.
They have the Netflix, the computers to get online and do their work, because some of them still work.
The Netflix, the computers, maybe the Facebooks too?
Yes, the Facebooks, yes. So, we look at all of that. So we're going to plan on a big change in the next year to 2 years.
That's an exciting thing to say, and I think that that kind of falls in line with some of the patient expectations probably nowadays, I would guess.
Yes, it does.
We've discussed a lot here today. Some of our viewers might be hearing this and thinking, this is too much information. I just need to know where to start. So Dr. Bjelland, what is the first step when looking into the distant or not so distant future in considering where our loved ones are going to live out their years?
Well, if you look at it as a process or a journey, you think about it starting first and foremost with a discussion. And because it's usually involving families, the first step is, if I have a choice, what do I want, and who do I want to know that?
Right.
It sounds simple, but unfortunately in our busy lives we often don't have those very frank discussions.
Right.
And I think that's the first step. And then to follow up with that is then to make a plan to meet with someone who can help you with that process. And it might be initially starting with meeting with your financial planner or an attorney or someone else too, to put some paperwork in place. But then there's also some potential people within our system that might be able to help you as well.
Absolutely, absolutely. And so let's talk about some of those people that folks can contact here at Mile Bluff. Terry Lynn, can you give us some information there?
First and foremost would be your primary physician. They are a load of information.
Right.
So they're very helpful on getting a lot of that started. If you need somebody besides physicians, then you can go to our social service department. They can help with some of the financials. They can help with the living wills, the healthcare power of attorneys. they can tell you about the nursing homes or the other services that are in our community.
Yeah.
And get you there or get you those information.
Yep, get you the information that you need. You guys have an awesome mission statement here, by the way, at Mile Bluff. And Raymond, I'm wondering if you could talk to us about how all of this relates to your mission statement here at Mile Bluff.
I think the key to the mission statement is the two words, compassion and progressive. And when we're talking about the levels of care. And so to provide passionate and compassionate and progressive care, that's what we're here for. And to provide that to the community and always going beyond expectations, that speaks to why we do what we do each and every day.
Really taking time to listen to the community and pay attention to what the needs are within the community.
Absolutely.
For sure. Dr. Bjelland, I know you talked a little bit about, or actually no, Raymond, I think Dr. Bjelland talked a little bit about Journey, how this is something that a family, whether they like it or not, they kind of embark on together for their loved ones. So can you talk a little bit more about the importance of that aspect?
Sure, I think that speaks to our mission of being compassionate to the family that's on this journey. And it is a journey, there's no question about it. And that's why Mile Bluff is here, to journey along with those families.
Absolutely. Well, I think if we learn one thing today, it's have those difficult discussions with your loved ones. Make sure that you have those difficult discussions because you don't want to get caught in a crisis situation, for sure. Well, thank you so much for joining us, everybody, today. I really appreciate the information.
Thank you.
And thank you to all of our viewers. We've been here at Mile Bluff Medical Center, and from all of us here at Wisconsin Doctors, we're inviting you to live longer, live better. We'll see you next time.